Dr. Patrick Turley, Professor Emeritus of the University of California at Los Angeles. Please, Dr. Turley, after all your experience, what do you have to tell me about the headgears?
Okay. Well, the headgear is one of the best orthodontic appliances that we have at our disposal. Unfortunately, it has fallen out of favor with, I would say, younger orthodontists because of the compliance issues. Orthodontists tend to want something that they don't have to depend on the patient's cooperation for. And so they've gone to other things such as fixed functional appliances and the Carrier and Class 2 elastics and even the removable functional appliances, which have been proved to be so effective, like the Bionator and the Frankel and the Activator, even they have fallen out of disfavor in the United States, again because of the cooperation issue. But what I have found is why totally throw away one of the best appliances we have at our disposal because a certain percentage of patients won't wear it? Why not try and determine ahead of time what patients will and what patients won't? So I've sort of found in my experience that patients fall into three groups. The first group has supportive parents. They have a good attitude. They will wear the headgear. It's not a problem, it's not an issue, and you can get some good results. The second group, it's a struggle. The parents are somewhat supportive, but they would rather not have to hassle the child with one more issue. But they do, and the child wears it, although they don't like it. And so you constantly have to be reinforcing their behavior at every appointment. And with that group, if you stay on them, you can get a good result. In the third group, you have parents that are not supportive. They may be divorced. They say, I have to pick my battles, and I choose not to pick this battle. And the child then doesn't want to wear it. Maybe one parent wants them to, the other one doesn't, and so the child gets caught in the middle, and so they don't end up wearing it, and so you don't get the results that you want. So when I decide that I think the headgear is the best treatment of choice in a particular case, I try and figure out which of those three groups this patient may fall into. And if I get parents that are supportive and the child says, yeah, that's not a problem, I'll do it, then I've hit a home run because as we know, the headgear is easy to fit. You only have to have two bands on the upper molars and you go to work, If the patient falls into the third group where parent doesn't like the idea of it, the child says, no, I don't want to do that, then I can decide ahead of time what other alternative to use, rather than wasting 6 or 9 months trying to fight the parent and fight the child. So anyway, that's sort of my approach. I probably have at least 50 children that are in headgears right now for various reasons. Sometimes I'm trying to correct a class 2, a full class 2. Other times I'm just trying to hold anchorage, hold my E space. So, and it's a very good appliance for that. And Lyle Johnson, who I think we all know, has published so much on class 2 malocclusion. when he's looked at all of his studies that have done on the class 2, he says the key to class 2 correction is controlling the upper molar. And what better way to control the upper molar than with a headgear? So I still use it and find it very effective, and that's my take on the use of headgear.
Thank you so much for this bedrock, Dr. Patrick Turley, from Manhattan, California, Los Angeles.
Manhattan Beach.
Manhattan Beach.